Hey, so we got Jake here, a 30-year-old firefighter here. So he's got a couple of histories of some things going on. We got probably a little better than 3 year history of some lower back things. Found some disc bulging going on. Has been dealing with a lot of stiffness, a lot of difficulty when he's doing kind of more, well, now a little less running now, but quite a bit of jujitsu training and a few other kind of goodies to stay active. And we're also dealing with partial tear of the MCL and ACL of his right knee. So dealing with a lot of noise, a lot of pain, just kind of not making things real happy. So we're trying to get in front of kind of a couple of these issues to keep him, one, on the job, two, enjoying his life to his fullest. So did we kind of cover all those bases, at least in general?
You did.
Cool. So I'm just going to go through a quick little screen of his movement and kind of show you how I would take him through an evaluation, identify some things and point them out to you guys so you get a kind of feel for what an evaluation with form and function would look like. So as you stand here right now, are we dealing with any kinds of pain?
Not right this second.
Okay.
I just feel stiffness right now.
Stiff in the knee. Just march a few steps, just get your joints moving a little bit. So as you pick it up and put it down, do we feel anything here?
No.
So the first thing I see is just as he stands, I'm looking to say how upright we look. And when he gets over onto this right side, I'm seeing a little tiny bit of a shift. So I'm already thinking we're not activating a lot of these nerves to help support his hip, which is affecting his lower back and all the way down the chain to his knee. And it's subtle. I mean, it's been 20 years of me looking at these things to be like, we found something right off the bat. So I'm seeing just a little too much translation left and right. So go ahead and balance on the left. And no pains, no problems, all is well here to balance. Unlock this leg. Any discomfort, pains, problems, anything going on here?
No.
Come back up. Let's try the other side. Just balance first. If you feel anything in the joint, stop. Don't push yourself through pain here. Any pains, any problems, anything going on here?
No, it just feels unsteady.
Okay.
I'm more trying to stand neutral.
Got it.
In this.
Harder to find
I got to
balance.
think more on this.
Balance over here and just raise on toes. Let's just go up and down a couple times and just kind of get a feel for kind of the smoothness, power, everything that you have into that calf driving your heel off the ground. Let's try the other side. And again, more balance issue. Strength feels okay. So the other part of that is if we don't have great strength, then I know I'm dealing with way more of a nerve kind of involvement in his lower back. So the good news is, great, we've got power, we've got strength, we've got that going on. Let's have you slip out of your shoes. I want to kind of see how some of this is moving around here a little bit. So first, we're just going to ease your way down. So just bend as far as you go comfortably. Stop if you feel any discomfort. Tell me when you start. So yeah, we're just going to just reaching down for toes. Any discomfort, any pains, anything coming down?
No.
And he's guarded. So now as I just see his back, I see this kind of rib hump on this side be a little elevated. So we got some rotation. So I know we've got a tug of war going on his right side.
I've been dealing with that. I've been told that. So.
Any discomfort coming up from that bent position?
Not today.
Widen your feet apart and then just drop down into your squat as deep as you go comfortably. Any discomfort in the squat?
No.
Cool. I'm going to have you lie on your back, head on this end of the table.
Recording.
All right, so we're going to start the good side first. Pull the toes up, hold it, don't let me pull you down. And I'm just looking for strength here, making sure nothing buckles. Hold your big toe up, resist me. And good and strong there. Toes up, hold it, don't let me pull you down. And this thing wants to give way. Hold your big toe up, and it wants to give way as well. So the next thing we have to do is look at nerve mobility. Well, the importance of actually seeing weakness here is it's signs that we've got something going on here. This weakness usually isn't weakness. It's inhibition because the nerves are being irritated in some way, or they're just not communicating correctly down to the foot and ankle. So we're going to check your nerve mobility here. So toes up, slowly lift this leg, stop if and when you start to feel a pull, pains, anything that you feel here. And where is it that you feel that pain?
I feel that in my lower back, above my left hip, a little towards
Okay.
the midline.
Now point your toes. And does that make it better, makes it worse, stays the same?
It makes it slightly better.
Slightly better?
I still feel it.
So it does change it.
Yeah.
So the fact that picking up the slack in the nervous system on his good side, causing symptoms into the lower back means we got some struggle going on. As bad as we thought like lifting on one foot would be, saying you don't have that nerve power output, just not having proper nerve mobility, even from the good side. This is called a crossover sign. So that crossover sign of picking up slack in the nervous system means we got more of a significant compression issue, and that could come from the disc, it could come from stenosis, it could come from the facet, it could come from piriformis syndrome, other muscle groups that cross that area, hip flexor being tight causing more compression, QL, lower back muscles being tight and just locking things up. So that's why it's just critical for us to get in front of somebody who knows how to assess and find these and identify these imbalances and get their hands on them and correct them day one within that session. So hip flexors, when tight, will start pulling on the pelvis and pull you into a little bit more of an anterior pelvic tilt, which is going to close off space in your lower back. So if we can get the adductors loose on both sides, then life's going to be a lot better. So it may not be the funnest thing we've ever done in our whole life, but it should actually give you a result. So the problem becomes when you're showing up in a lot of these other physical therapy locations, they just don't have any manual hands-on therapists that are going to and transitioning to what they consider like evidence-based medicine or EBM practitioners. And what you end up with is like a glorified personal trainer. They don't touch, they don't identify, they don't get their hands on to release things. They just jump straight into exercise. And if I give Jake here a ton of exercise right now while all of his muscles are grabbing on for dear life, the likelihood of me making it worse, not better, is actually pretty high. And the speed with which you can actually get progress is not very good, because you have to work through all of this tightness, all of this stiffness, all the neurologic kind of output of these muscles wanting to grab on for dear life. And if I don't get my hands on to downregulate his nervous system, get his tissues functioning well, we're not going to do very well for our clients.
So what are you doing here, Charlie?
So we're going to bring this across and we're going to check into some of these glute muscles that are actually going to cross the kind of sciatic nerve area. So people will say, oh, this is all related to piriformis syndrome. They give us glute stretches. This is like a 13 out of 10 right here. Little pinch in the groin.
No, I just felt that. Yeah, you're okay. I'm sorry.
Yeah, no, you're good. So I need to know. So you're getting more groin?
Whatever you did right here, just shot this way.
Okay. So we're going to ease our way into that a little bit and see if we can't release some of it. So here's where kind of patient education has to come in. So this is somebody who's kind of constantly working out, constantly working, doing all this stuff, and now we're starting to deal with this disc problem that's showing up. And the disc is 70% water, so that should be the thing that's shock absorbing. And if we've beaten the tar out of this thing where it's starting to get soft, getting mushy, starting to bulge, we've got to make sure that hydration is absolutely critical, because if we're in a dehydrated state and we've lost some of that water content in our disc, it's now going to collapse even further. So we got to make sure that we stay hydrated to help kind of plump the disc as much as we possibly can to give space to this. So it's not just do we mechanically manipulate something to get it moving. How do we help support this from the inside out? And if you don't believe it, I want you to head over to the website. I've actually published a recent blog post about why hydration is so critically important to spine health. So go check that out.
Okay, go. What are you doing?
So since we were stretching hip and he had a little bit of discomfort in the knee, it wants me to just kind of get into this joint and figure out, all right, what is the stability? If he was told he had partial tears in the ACL, MCL, I want to make sure that I'm dealing with something really structurally sound here. So I'm going to do a quick little Lockman's test. This is the go-to, and you see these kind of Sundays in the NFL when people take these shots to the knee. So what I'm trying to do is actually get my hand right here in the front of the shin bone, and I'm kind of making a C with my hand, and I'm giving a little force this direction, because the ACL stops anterior translation of this leg, and when it's torn, it slides excessively. So what I'm trying to feel is, one, how much does he slide, and two, does it stop or does it feel mushy at the end and springy? So for me, he comes to a nice solid stop. So his ACL's intact. We didn't tear this thing to the degree that he needs to go get this thing repaired. So that's the first piece of good news of the day. So let's assess kind of its stability. So MCL stops these two bones from gapping on this side. So it's like a piece of tape going from this side to this side, holding that together. So if I stretch this thing out, there should be excessive movement this direction. So for him, I'm digging into this thing and trying to put that little lateral stress in. One, I want to check the irritability of it. So is it painful at all to do that?
No, but I feel it like
there's a sense that you're getting a little stress to it.
Yeah.
So not severe, and secondarily, good kind of mobility. So it's not excessively mobile. He's got enough MCL tissue. And the other thing is the MCL is the one broad fleshy tissue that has at least enough blood supply where it can kind of mend itself. So as long as he didn't get a complete rupture, these heal. Lift this leg again.
Yep.
Nails the low back.
Yep.
Point the toe. Same, different.
About the same.
Okay, relax. So the other thing that a lot of people don't do is they don't go back and test their work, because what we have to do is pre-test, post-test. What's the thing that's making the difference? That way we can really truly focus on the thing that's going to bring our client the most relief. So for me, all right, we worked on releasing the glute, releasing the adductor, and then we went back to our leg raise. Did it change much? No. So am I going to spend all of that time in the future or send him home with a bunch of exercises for stuff that isn't going to give him an outcome? No. It's information for me, it's information for him, and it's helping me kind of decide how best to attack this problem. From the front of the thigh through the pelvis to the front of the spine. So it travels all the way up to the top of the front of L1, so I got to go fairly deep to get to it. Breathe, keep your abs relaxed, and keep the breath kind of normal depth. So not a deep breath, and then again, when I ask you to lift, up, and then right down where we started. So this is probably the least fun one we do for our clients because it is quite uncomfortable. But if we can do a pressure point release here, this is one of the muscles that's going to make the biggest difference to releasing compression across the lower back. Lift this foot an inch, set it down. Sharp there?
Yeah.
A lot, a little bit medium?
Sharp. I would say medium.
Okay. So we're going to find the worst point. So right now, I'm just going to try to identify the worst point and release it. Lift and drop. Better, worse, same as the last time we did
It's
it.
a little worse.
A little worse. There may be points worse than that one, so hang with it. So get yourself mentally prepared.
Yeah.
This one can be a battle. Point that we hit, he described kind of some pain shooting across his abdomen, and that's basically what's called the Jones point. So these are kind of trigger points that refer pain all over. And those can be kind of critical treatment points to alleviating a lot of these symptoms. So I want you to slowly straighten this leg out. So it's going to be a little sharp as we do that, but I want to kind of maintain pressure here and kind of allow that muscle to release. So slowly extend and rest your leg on the table. Keep breathing. So here's the other thing is now that we've got 3 years of a disc problem, we're already seeing some of his compensations. And it's one that I see so commonly in disc is that he holds his breath. And why do you hold your breath so much? Is that you're trying to cheat stability. You're trying to find stability for muscles that aren't doing their job. You are so guarded that you will hold your breath and bear down. Well, here's the problem with bearing down. If I bear down, I have more compression coming across my lower back. So it's a catch-22. I created stability, but compression. So we've got to find a way to turn his abs back on and stop the compressive forces that he's putting into his low back. And blow it out. So now that we've gotten our hands on it and allowed it to release per se, we're going to come close to this edge of the table. So we're going to scoot to the edge, and now we can actually do a stretch. So if I just went straight into a stretch, I would have had a tug of war with muscles that are wound tight, that the nervous system was upregulated. So grab this knee and hug it to your chest. So as far as you go comfortably, not killing it. So find that edge, and then we're going to allow this leg to hang off the table. So breathe, relax, let this drop. So by pulling this knee up, I'm kind of rotating the pelvis width so I can be more efficient in allowing this hip flexor to stretch. Is there back pain or does it just feel like stretch?
It just feels like a stretch.
Cool. So when we're really unstable, this can hurt the low back, so you got to listen to your body. This isn't going to be for everybody. Gently pull this knee up into my hand. Is there pain to lift?
No.
And drop. And you're also holding your breath.
Sorry.
Everybody,
Yeah.
literally everybody who's got this issue does this. So we've got to start to listen to your body and breathe. So lift, maintain, and drop. And I've almost had to retrain myself to say maintain instead of hold because everybody thinks hold means hold your breath for some reason. After 20 years of doing this, learn how to speak differently. Pull up and drop.
Way better. It's looser.
Feels looser?
Yeah.
Okay, took the edge off it some. This is good. All right, so now we're going to look into checking his core muscles. So already if we say we're seeing this compensation of him holding his breath, the likelihood of him finding TVA, transversus abdominis, the internal back belt, is probably not going to be very good. So we got to figure out how he's coordinating his core muscles. So as somebody who's like himself, fit, lifts weights, pushes his prime mover muscles, going to be strong as all get out, but we need to find and identify ways to assess these little tiny deep stabilizer muscles and ones that need more coordination than just power. So squeeze your knees into my hand. So we're going to find some muscle groups here. We're going to push your lower back down into my hand, pull your belly button in. So he's compensated a little bit to flatten. Keep breathing, flatten, so smash my hand. So we're struggling to even get into a pelvic tilt because he's so stuck in extension right now. So we're struggling to find which muscle groups are actually going to cause him to pelvic tilt. So maintain that, don't lose it, keep squeezing, keep flattening, keep breathing. Rest. Hard to coordinate all those guys together?
Yeah.
So that's everything. So it's like once we teach each individual muscle to turn on, fine, they do fine. But the second you start to add 2, 3 other things to make them work together in a synergy, turn one on, shut something else off. So we've got to figure out how to reteach and re-educate some of these muscles to fire and shock absorb for his spine correctly.
Sorry. All right, go for it.
So we're going to do a little test/treatment. So when we last found that pelvic tilt was not as coordinated as it needs to be, phase 1, this is going to be the homework. We got to get his core turned on in that way. So homework for me, any isometric like this, 10-second holds. The second thing we saw, not a great deal of nerve mobility. So we got to figure out, okay, great. Could it be just compression? Fine. Could it be from the rotators of the hip? So we're going to play with the rotator of the hip and figure out, is that a contributing factor to what's going on here? So you're going to flex your thigh muscle, push the back of your knee to the table, pull your toes up, and all I want you to do is gently rotate this thigh all the way in as far as you go without the pelvis doing that job. Is there pain to do that?
No.
And roll it all the way out as far as you go. So keep the toes pulled up, roll the leg all the way in, all the way out as far as you go. Roll it back in.
I just feel it rotate.
Want
like
to
I
move
wanna
with
move
you.
it.
So the critical part of kind of getting that quad set is you get something called reciprocal inhibition. So I'm turning this quad on to see if I can't get into some slight hip extension. Hip extension means hip flexor shuts off. We're constantly dealing with the hip flexor overfiring, and one of the reasons the hip flexor overfires is it's one of the first muscles that's innervated by the nerves that exit the lower back. So if it's pissed off from it having a bulge or an irritation or loss of space or compression or working out or running, whatever that thing is, it's getting more signals from that segment and causing that muscle to kind of withdraw. So because it crosses the spine, if it's shortened and constantly contracting, it's compressing the low back. So we're getting some reciprocal inhibition from a quad set, and I'm turning that hip rotator on and off so I can teach it how to turn off. If it's constantly on and it crosses the sciatic nerve, I want it to be able to turn off and relax.
I asked the question, what is reciprocal inhibition?
So reciprocal inhibition is basically if I do a bicep curl, I need the tricep to shut off so I can actually allow my elbow to bend. In the shoulder or the upper back or neck, what you see is upper traps being tense and lower traps being weak. I have to turn this lower trap on to shut the lower traps off. So that's one way that we alleviate some neck tension here. In the lower back, we see this with the hip flexor and the hip extensors. We can turn that quad on and move that hip into some extension to turn the hip flexor off. So if I can move into extension, I gotta shut this off. And that's what I'm really trying to trigger with that quad set. What do you feel on the left compared to the right?
Like it's easier.
Yeah, you got more control,
Yeah. Like it's, yeah.
more freedom of movement. So at home, this can be part of the homework as well. So if you're seeing imbalances here, this can be something that you program in to your routine to try to get the hip rotators a little more symmetrical left to right.
You're good.
So when I was kind of giving the little pre-eval kind of discussion to figure out what have you tried, what works for you, what doesn't. The stuff that he's been to is more chiropractic and massage, and the outcome has not been good. It's some days are worse off to try to get it treated than to not. So is that pretty accurate to what your experience has been? Chiropractors left you sometimes worse off than walking in?
Yeah, sometimes like going into the chiropractor, it literally does nothing for me. They might get like a crack or two, but as soon as I get up, I'm still tight. There's no relief, and I just continue my day with the pain that I started with.
Yeah. So for me, it's like the adjustment is potentially necessary, but it's only a small component of what is necessary. So if that segment is stuck, that's great. He's still dealing with all of the soft tissue issues. He's still dealing with not being able to get and identify the correct muscle groups to turn on to be able to do some actual proper self-care. So like it's a drop in the bucket to what he needs. And in some cases, when we have some instability in the segment, an adjustment, a high velocity maneuver can cause you more grief, or again, just leave you not any better off than where you walked in. So critical to get that assessed properly. Toes up slowly. And what's that feeling like at the moment?
It's fair. Like I feel it just pull the lower back a little bit, but it's not painful right now.
Drop. Toes up, lift this leg as high as you go comfortably.
Yeah, right there.
And again, that's more lower back, or where do you feel this most?
Right now with my leg, but
Less back, more
less
leg.
back, yeah.
Good. So things are starting to change. We're moving in the right direction. So bad news is when we have both sides and a crossover sign, we got to do a pressure point release on both hips. So we're going to dig on that hip flexor on this side. So lift one. Lift this leg high as you go.
Oh yeah.
Wow.
This guy lifted his leg. Look at here. Let it come down. So,
I need to get that from this
all right. I don't want him to overfire his hip
No.
flexor though, so.
Pretty good.
All right, cool. Let it come down. So, yeah, all these evidence-based therapists that say manual therapy doesn't work, that's in your face right there. All right, toes up. Lift this leg high as you go.
Oh yeah.
How's that feel compared to last we did it?
This is looser, like
Yeah,
everything.
and we didn't mess with this side. It was a
Yeah.
lot locked on the opposite. So, I mean, we've got to know what the hell we're doing. We have to have seen some of these in the past to figure out where there's buttons and triggers are to actually get your patient some relief. All right, both knees bent so we can let that lower back rest in the low. We're going to bring those knuckles to the ceiling. So interlock those fingers and then take those arms straight overhead as far as you go. So this pullover kind of position tells me a few things. So the lats themselves act to the lower back. So if I find somebody who's reaching overhead and I see a big old rib flare and the ribs want to follow, it tells me that the lats are probably a little bit tight and actually also causing some compression in the lower back. So I want you to think about flattening your back to the table again. So pull those ribs down. Tighten, tighten, tighten. You feel some stretch in the shoulders? Yeah. So is it more along the lats or do you feel the top of the shoulders?
Top of the shoulders.
Okay. So I'm going to make a little pass along some of these kind of usual suspect spots. Found a little mess there.
Yeah.
So some soft tissue work here can actually alleviate a little bit of that nastiness that's going on there. You're like, this is part of my back problem? Yes, this is part of your back problem.
But you're barely pressing right now?
I am pushing this hard right now.
Yeah.
Explain to her why are you up, so someone asks you this, why are you up there when this is a back problem?
So I'm up here because of this back problem because, as I mentioned, the lats themselves attach from the shoulders through the lumbodorsal fascia to the lower back. If my lats are in spasm or if they're shortened, it's crossing his lower back. So we've got to identify all of these muscle groups. It's not just your hip flexor, it's not just your QL, it's not just the paraspinal muscles that need to get hands-on or cupped or scraped or whatever you're trying to do to alleviate this problem. We need to think more globally and figure out what other structures could be involved in compressing his lower back. And the lats are often missed. Again. Breathe. How's the side compared to the other?
Good.
Doesn't have the same nastiness. And that's kind of the usual suspect as well, because when we're dealing with hip stuff, and this sounds as far-fetched as it gets when it comes to kind of some of these theories in medicine, but it's stuff that I've seen over and over and over again. Eastern medicine philosophy, and the easiest way I can bring it back to in my education was embryology. When we were an embryo and just a bundle of cells, there was a point within our development that those cells unfolded and your hip was your shoulder. So we've identified some of these kind of patterns of dealing with shoulder problems that you see these same kind of restrictions in movement in the hip as well. And the shoulder doesn't respond until you play with the hip. The hip doesn't respond until you play with the shoulder. So there are some little mirror neurons or otherwise that are still kind of communicating with one another. And high as we go. And bring it down. How's that feeling at the moment?
Good.
Cool. Bend both knees. So the other thing that a lot of people love to do is when they're going to do an adjustment, they just start right at that segment. They're like, oh, I got a 2-level herniation. We're going to do all that work right here. Well, the nervous system runs from your brain all the way down through. So we got to figure out, is there something stuck somewhere else? So we're going to start from the top down, far away from our issue, and work our way down to that issue. Take a nice deep breath and blow it out. Again, deep breath and blow it out. Now, rest your arms, straighten legs. Let's start with this side. Lift the leg high as you go and set it down and lift the other. And how does this feel compared to the last we did it? Starting to ease up a little bit.
Yeah.
Let's turn to your stomach. Let's check a couple other things here. So prone on your stomach is typically the worst spot you want to be. So I'm going to get a pillow and just tuck that underneath your belly button just to kind of take some of this stress off. So you don't want to be in a ton of extension of the lower back. In extension, we're actually closing off all of that space. So if you're a stomach sleeper and you're dying to get back to your stomach, we got to start propping stuff here just so we can stay relaxed and keep those segments open in the lower back. So we're going to look around a little higher. Got a little nastiness up top. I feel you flinching against me. Big difference between left and right, or does it feel about the same?
The right side, I felt, yeah, right there.
That's our spot. So this spot high above our area of the bulge is a common hot spot because when that hip flexor gets so wound tight, we live in such great compensation. The hip flexor's winning, and now we make our glute and our hamstring very inefficient at being hip extensors. So we got to find extension somewhere else in the body. And typically it's up top. We start using these large muscles, the erectors in that thoracolumbar junction way up top here. And the other thing that we'll see is the calf. So my runners who are dealing with low back issues, who've got calf strains, Achilles tendonitis, they've got a back problem and they haven't unwound a lot of these little trigger points. And this as well because that paraspinal crosses the low back down low, but we're not attacking directly to where that disc bulges just yet. We're going to see if we can do some cross friction. This could be an area that you do some cupping to kind of downregulate the nervous system. You could do some light percussion. On a first-time patient, I probably wouldn't, because that can go one of two different ways. If we're dealing with that much instability, that amount of vibration can be really irritating. So we can't just gun that away. Give a little movement to that segment and see if we can't get some relief. Take a deep breath and blow it out.
Oh, thank you. Sorry. I'm so sorry.
All right, let's turn over to your back one more time. I just
wish
want to
I would have
retest.
like had the little mic right on top of your back. I wonder if I could hear it.
How does it go there? What's this feeling like at the moment?
It's good. I just feel the stretch in my leg now.
Back stuff's resolved.
Yeah.
Good. Cool. All right. Now I'm going to have you lie on your side, face this way.
Okay.
We're going to see what this lateral stability component's doing. So if we're
Now ready.
So when we're dealing with back problems that turn into kind of medial knee problems, the thing I look for is the nervous system making sure that that glute med is doing its job. Gluteus medius is that stabilizer. So we went all the way back to his initial and saw that he was rocking too much. And that was my first clue that this guy wasn't doing his job. So I'm going to get my hands on it and say, how much force can you produce in this glute med? So lift this leg, turn that toe down. So we're going to isolate that muscle. So hold it right here. Do not let me pull this leg down.
Okay.
Take a deep breath and blow it out. Hold, 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 hold. Can't. Any pain? Just hard to hold.
It's hard to hold.
So it wasn't a pain inhibition issue. He wasn't dealing with pain. He just couldn't find that mobility. So we're going to come to this edge. So here's where potentially that chiropractor gives you some relief because they give you some space. We don't have to do anything that violent or that aggressive in terms of giving space to some of these segments, but even relax and let the shoulder fall back a bit. Any pains to get to this position? Just muscle stretching. Take a nice deep breath for me and blow it out. So we got a little cavitation in there, a little snap, crackle, pop. That's not necessarily for me the goal. Like chasing the snap, crackle, pop is not the be all end all. It's not being in or out of alignment. It's about, can I get that nerve to do what I want it to do? Can I give it space? Can I get it some help? Lift this leg one more time. And again, just more muscle stretch, not pains.
Okay.
Face that way and let's retest your strength. So was this weak or was it inhibited by the nerves of his lower back? That's the question. Hold it. Do not let me pull you down. Resist. Keep breathing. Does that feel different to you than the last time we did it?
Yeah.
All right, let's have you stand. And just march a few steps. We've been on the table moving around and getting worked over here. So we're just going to kind of get some joints moving again. Balance on that right leg. And then come down into the little mini squat again.
Okay.
How's the stability of that feel right now?
Good.
A little different than the first time we did that.
Yeah.
Cool. Feet about hip width. Reach down for toes. Stop if and when you start to feel it. And what's the bend feel like to you compared to the last we did it?
If it means anything, I've never been able to touch my toes. This is like a first time thing, so it feels good. I just feel it in my hamstrings
Not
with
back
that
pain.
stretch, yeah. But usually in the morning or like mid-afternoon, I feel it all in my lower back and it radiates to like the mid-spine area. So,
But none of that is present right now.
yeah, none of that is present right now.
Fantastic. All right, next. So I was just going through some aftercare stuff and kind of discussing the do's and don'ts, and asked if he'd tried any type of supplements or anything else he's tried, and he's gone to and attempted collagen. And it's kind of weird. We're right at that kind of transition age at 30 where your body is just beginning that slow aging process of the 1% per year. So this is about the time that I would actually start considering doing a collagen supplement. Up to under 30, I would say you've probably got enough enzymatic activity and youthfulness for your body to regenerate and mend tissue that I wouldn't necessarily run straight to it. But for him, because he's as active as he is, because we've got these kind of couple of different structural issues, collagen's going to be a good option for him. So we were discussing that, and I don't know how it came about, but he was discussing some other kind of digestive kind of concerns that kind of started since the pain started, or how did that?
Right. So since I injured my back, continuing moving forward after that injury, I've noticed that I've had just gut problems and just
Yeah. So, and that's not unusual too, because I mean, whether we're in physical distress, psychological distress, any types of stressors, you get into this fight or flight. We got this sympathetic and parasympathetic nervous system. When we get into fight or flight, it's sympathetic. It shuts down the gut. We kind of now have to use those resources for work, to escape, to flee, to whatever that needs to be. And in that rest and digest parasympathetic kind of style, where we're safe, that's where our gut function actually comes back. So for us, when we're dealing with this kind of chronic pain or those type of issues, it's very normal for the nervous system to kind of constantly be in this sympathetic fight or flight gut kind of dysfunction, whether that be hypermotility or hypomotility issues in the gut. So there are things that we can do with PEMF, electromagnetic fields, to actually alter the sympathetic and parasympathetic nervous system to actually assist with the recovery in those type of symptoms as well. So it's not just, hey, can you fix my back pain? Because that's what most people think of a PT as doing, or can you rub this out? There's a whole hell of a lot more that we can do to help support you.
Okay, go touch your toes.
crazy.